much because we are so excited to have Professor Rawal from the Karnali Health Science Institute in Jumla, Nepal. And we're especially thankful to Dr. Pradesh Pradel, one of our very own master students, for honoring us by inviting Professor Rawal. I think when I first met Pradesh, we had so much synergy between the work that he wanted to do to help rural Nepalis to get healthcare, and as well as being an associate professor in this department, I also am the chief medical officer of Partners in Health, which is an international medical charity, and we've devoted a lot of our time on trying to train the next generation also of doctors and nurses and community health workers. And now we're very excited that we have a collaborative between this department, the Department of Global Health and Social Medicine, and our new University of Global Health Equity, which is also in a very rural part, maybe not as rural as yours, but very rural part of Rwanda, also up in the mountains. Again, not as high as your mountains. So I think there's a lot of synergy here. Here's our chairman. I'll let you greet. Yes. So I think there's so much synergy between the work. Our department has a long history of really trying to look at the aspects of the social world, the local and global moral world that impacts on the care of the poor around the world. So we have Mary Jo Good, who's worked in Indonesia and China. Vikram Patel has worked in India and Africa. We've got so many of our graduate students who've worked in a variety of places. So we hope that you'll feel at home. You're talking to a group of people who really share your values, and inform us about this amazing institution that is very new, trying to train doctors, nurses, pharmacists in rural Nepal. So without further ado, Professor Rawal. Of course. Okay, we'll see a video of how rural it is, and we can decide if it's the most rural.
Let me take you on a trip to the rural hills of Nepal and show a perfect example of healthcare in the mountains. This is the story of Karnali Academy of Health Sciences, a hospital nestled in the remote hills of Karnali, Nepal. Nepal is renowned for its mountains and trekking trails. It sure is fun when you go hiking on a weekend with family, but when a sick patient with heart failure or a pregnant woman cannot have basic health care even when they are prepared to tread the dizzying altitude and tough trails every day, it breeds a heartrending situation. Some years ago, people had been dying in Karnali because they didn't have access to basic health care. Minor ailments like diarrhea or trivial infections could render a patient critical. If you ask a local, getting to the main hospital facility is simple, however not easy. You walk. The nearest airport, many days away on foot, rough dirt at an altitude of 7,700 feet. Traveling by road to the nearest tertiary care facility takes more than a day, and at times, one has no option but to reach the capital city Kathmandu for healthcare services. Now, the times have changed, and people are able to get similar services in our 300-bedded hospital. Our hospital has been providing medical services in the hills of Nepal since 2011. Karnali Academy of Health Sciences aims to solve the rural healthcare shortage in Nepal. It has a purpose and a mission. The maternal mortality rate in the province is 172 per 100,000 live births, higher by 14% than the national average. And the infant mortality rate is 47 per 1,000, higher by 62% than Kathmandu. Trauma and fractures in the rugged mountains have their own challenges. If a local sustains a hip fracture and there had been no hospital in Karnali, they would have had to pay at least 8 to 9 times more for the whole treatment while traveling all the way to Nepalganj and back. But since KAHS has a good orthopedic service at present, the surgery costs only amount equivalent to the cost of hiring the ambulance. However, challenges still remain, as it takes a week to get to Jumla from the nearby districts like Humla and Bajura, where the KAHS is located. Our facility is a training hub for the district health staff ranging from ACLS or BLS to safe baby delivery training. As a community, we train and prepare the human resource to create a competent workforce in the Western Nepal. We run a medical and nursing school in Jumla, and in 2021, we started training our first batch of physicians, many of which we hope will join our rural health team after graduation. Our training curriculum for pharmacy and public health degrees are job-oriented. We continue with the mission to prepare the next generation of professionals, especially those who aim to serve our region and its people. In its model of healthcare, our hospital partners with the existing local healthcare systems and they support each other. Be it a vaccination campaign or fighting through the COVID-19 pandemic. We believe in health system strengthening and provide specialist services to the 13 neighboring districts like Dalpa, Humla, Mugu, Rukha, Bajura, and Circuit. Of course, we do face hurdles along this journey. But we continue to work effortlessly to send health workers to nearby facilities and hills. We are hopeful, if we continue to partner and prosper, we can change the Human Development Index of the nation in the next 10 years. Karnali Academy of Health Sciences is a team. We strive to bring rays of hope for a change. If you share the same vision and bear a similar mission, come join us.
Thank you so much, Jaya, for introducing me. Good afternoon, everyone. First of all, I'd like to thank Department of Global Health and Social Medicine of Harvard Medical School for providing me this platform to tell something about our institution, Karnali Academy of Health Sciences. Karnali Academy of Health Sciences is located in one of the most remote parts of the world, providing quality healthcare, health education, and conducting some health-related research since 10 years. So for next 1 hour, I'll be talking on Karnali Academy of Health Sciences, and I'll try to discuss how a medical university in Nepal's remote village advances global health. In this talk, I have divided my talk in 3 parts. I'd like to take this platform as an opportunity to describe some important aspect of my country and my place, Karnali, where I'm living since long. That would be the first part of my presentation. In second part of my presentation, I will describe some details of Karnali Academy of Health Sciences, how we are providing quality service out there and how we are advancing the health education in Jumla. And the final part of my presentation will be on establishment of Department of Global Health and Social Medicine in Karnali Academy of Health Sciences, and we'll talk something about the possible collaboration with Department of Global Health and Social Medicine here in Harvard Medical School. If we see the global map, Nepal, very small but beautiful country situated between 2 large power nations in the world. People's Republic of China in northern part of our country and Democratic Republic of India in southern part of our country. After the promulgation of new constitution in 2015, Nepal consists of 7 provinces, and Karnali province is one of them. Geographically, Karnali is one of the largest provinces among all the 7 provinces in Nepal, but it covers only the 6% of population of our country. You must have heard many things about our country because Dr. Pradesh and other Nepali colleagues are here since long. But I would like to highlight some important aspects of our country. This is the Nepalese flag. It is very unique, only irregular separate flag in the world. You could see the blue border, that the borderline of our flag is blue color, which denotes the peace and compassion. And the base of the flag is red color. Red color is the national color of our nation, which denotes the bravery of Nepali people. On the left of our country, there is a place called Lumbini, the birthplace of Lord Buddha. As you all know that Buddha is synonymous with love, peace, and compassion. And he has innovated several practices, several theories, and several ways of relieving the human sufferings, like motivation, mindfulness, and ethical living. If you try tracing the most glorious view on Earth from space, you firstly will behold the tallest peak in the world, that is Mount Everest. And for our knowledge, 8 out of 10 tallest peaks in the world are in Nepal. That means Nepal is one of the best places for mountaineering, hiking, and trekking. Though the Nepal is very small, it has rich geographical and cultural diversities. You see, Nepal ranges right from 58 meters from sea level to the tallest peak in the world, that is 8,849 meters. And in northern part of Nepal, it is almost fully occupied by snow-capped mountain. In the middle part of Nepal, it is occupied by many hilly areas. And in northern or lower part of Nepal, it is plain land, which is bordering to India, most of the places. We have rich cultural diversity. This is the picture from the capital city of Kathmandu of Nepal. Kathmandu, very small city, but there are 7 UNESCO World Heritage Sites only in Kathmandu. Today we'll be talking about Karnali province, which is quite different in many aspects in our country. And that district is Jumla, where Karnali Academy of Health Sciences is located. It is centrally located in Karnali province. Before going to the overall health status of our Karnali province, Karnali has a proud history. Back in 11th to 15th century, Karnali was the main trans-Himalayan trade route between that Gangetic plain, that is current India, to Mount Kailash, that is current that autonomous region of Tibet. It was the only way of pilgrimage route between India and China that time. And it was ruled by Khas Kingdom, and Khas Kingdom was said to be one of the strongest kingdom among all, and that kingdom was the most prosperous kingdom before the unification of Nepal. There is a Kailash Mandala near to my district, home district, Humla, and Kailash Mandala was regarded as the axis mundi. That does mean it is the confluence of multiple belief systems like Hinduism, Buddhism, Sikh, and other belief systems. So, but after the great earthquake in 1505, some geopolitical changes in East India Company and Nepal-China War, that changes our Karnali region. Even after the Gorkha annexation in 1789, the marginalization of Nepal, of Karnali region further, it has been increased. not only after the Gurkha annexation, after the establishment of democracy in 1951 in our country, the Karnali region is still left behind in holistic development of the nation. So it has a proud history, but difficult current situation. Karnali region is the most beautiful province among all the 7 provinces in our country. If you consider the natural beauty, it is the most beautiful. And Karnali was the origin for Nepali language. Nepali language was originated in Sinja Valley of Jumla district, where Karnali Academy of Sciences is located now. You could see the picture is Vara Lake. It is only 35 kilometers from Karnali Academy of Sciences. This is the largest freshwater lake in our country. There is another place, very popular tourist destination, Safe Oksundo. This is in Dolba district in Karnali. And there is a place called Chumchor of Jumla, where rice cultivation carried out at the highest elevation in the world. So after knowing this, there is the possibility of cultivation of high-valued medicinal plants and herbs in that locality as well. But there are several challenges associated with our province. Of course, there are several opportunities with those challenges. Karnali is remote and mountainous region, having high poverty rates. Multidimensional poverty index of Karnali is almost double than that of that national average. The national average of multidimensional poverty in Nepal is 16%, while you can see the very high percentage of poverty index in Karnali. Karnali is prone to natural disasters like landslide, floods, earthquake, and there are several challenges to provide health services in our part of the world, like difficult geography, limited infrastructure, many cultural and social taboos and other factors, shortage of quality health manpower in our setup, and even after federalization of the country, our central mechanism is not encouraged to distribute the resources to the remote place of Karnali. They are focusing more on central part of our country and around. Obviously, there are limited health education and awareness in Karnali. Before going to the Karnali Academy of Health Sciences, I'd like to share some pictures and videos. After watching those pictures and videos, you will have a better knowledge of the people of Karnali, how they are receiving the care. This is the picture of my one uncle. You could see very blurry and black and white picture. It was 20 years back. He died at the age of 45 years. And while I was a medical student, I got to know from my family relative that he was complaining of fever and chest pain since 1 month. So here I'd like to ask you, what would you do if you have fever and chest pain here in your setup? What would be your next step of your management? What would you do?
Check the sputum and get a chest x-ray.
Chest x-ray. What I think is you got an ambulance or you go by your personal vehicle to meet your that primary care physician and get treated. That is as simple as that in your part of the world, but the story of my village is quite different. He died without any diagnosis and any treatment because of 2 reasons. He had to go to district headquarters where there is one small hospital, and that time there was no any doctor available. So he had to take another flight, 1 hour flight to reach to They are nearby urban center, which is quite impossible for not only for my uncle, for most of my villagers out there in Karnali because they cannot afford the treatment and it's very far from their locality. This is the still the situation right now in Karnali, the remote villages of Karnali. And the number two reason is they believe more on shamans, traditional faith healers. So these are the two challenges. And we lost him at the age of 45 years. This is the tip of iceberg. This is the representative sample. The life expectancy of Karnali people that time was 36 years, while the life expectancy of people living in Kathmandu was 63. Just 25 to 30 years back. Even there is disparity now. So with a very low that life expectancy, this region has many hidden stories of people losing their life with their cooking. And I'd like to show one video that I got from my friend who is working in Doctors for Nepal. And this is from Kalikot district, that bordering district to our Karnali Academy of Health Sciences. Can you help me to play this video? This is related to the mental condition of Karnali mother, how they are facing difficulties to get proper health care, how they reach to the health facilities. See? Awful plight of them that they had to prevail. This is the probable case of miscarriage, some obstetric complication. She had to be carried by human ambulance. You see, because of the lack of transportation, you don't get ambulance that easily. See, you can imagine that steep terrain there. Even after having few days of walk to reach to the health facility, you are unsure that you will get doctor will treat you after having that difficult journey. This is the real scenario from Karnali. Yeah. So the maternal mortality rate of Karnali province is highest among all the provinces in the country. Mm-hmm. So because of difficulty in transportation, access in healthcare, etc. Go back to the slide, please. No. And see, okay. See, one of that popular daily newspaper has published the news related to that maternal mortality of Karnali province, and that was the editorial tying mothers. Go back to. First one. See, deprived of timely care, Karnali mothers die untimely deaths. 17 pregnant women, mostly between age 15 to 25 years, lost their lives in the last fiscal year. That was the news published 1 year back in Kathmandu Post Daily. Next, please. So, is there any orthopedic surgeon or primary care physician in this hall? Would you describe this picture? What had happened to that child?
Sorry.
Yeah. I met him during my the health camp in one of the district in Karnali. That was Simikot District Hospital, and
is it was compartment syndrome?
Compartment syndrome, forearm. He's probably got a humeral fracture associated with it.
Exactly. See, there's a history of 6 years old boy who had history of slip fall injury in his village, and they went to local bone setters. That is the usual trend that our people are doing in Karnali province. He went to bone setters, and bone setter applied this split very tightly. And I want to play the video. And so the arm distal to that bandage was totally necrosed. There were multiple blisters, no circulation, and nerves out there were not working. And we did repeated debridement of that arm, repeated surgery. After having repeated surgeries, you see, I immediately released that splint, and
it's an anesthesia.
yeah, I put anesthesia, but it was just because of fear, you know.
Yeah.
Yeah, the part distal to that is splint. It's totally black, multiple blisters, established compartment syndrome, and it's disastrous, you know. So I had counsel regarding the possible consequences, but we could save the limb, but that limb was totally non-functional. See, it was back in 2015, and I took his photos few days back, and this is the current situation. You could see there is a Volkmann ischemic contraction, PIC, in his forearm and hand, and the limb is totally non-functional. This is also a tip of iceberg. That is how the people from Karnali are living in remote part. See, many cases, this case, we amputated that limb distal to elbow, forearm, and the case was same. Local bone setter applied tight splint, and there was a development of compartment syndrome, and everything was. So this is the real scenario of healthcare situation in most part of Nepal. So where does Karnali stand? If we compare the various developmental and health-related indicators between your place and our country, there is a huge difference. Likewise, if we compare those indicators between Nepal, national average, and Karnali, there is similar sort of difference. You know? See, we can see in this chart, life expectancy of people living in Karnali is 64 years, while national average is 71. Similar difference. Maternal mortality of the women living in Karnali province is 172 per 100,000, while MMR of Nepal, that is average, is 151 per 100,000. This is that level of difference. So at present, Karnali majorly relies on health camps in that remote part of Karnali. See, these two pictures are from health camp while I had attended in remote part of Umla district. The first case, the similar picture, child went to the bone setter and put tight that is split, and there was huge swelling over the hand. And second case is the case of club foot. I think there's deformity around the ankle. So I tried to put that, I tried to correct that ankle with plasters, but we have to put serial casting for weeks and months. But sad to say, the parents and the child had to travel 3 days to reach to my center. So I counseled them to come to me, and we corrected the deformity. And it's very difficult to travel 3 days to reach to one tertiary care center.
With a kid with a club foot.
Yeah, with a kid with club foot. And David Citrin from Washington University had done the research on the effectiveness of health camp in Karnali, and he had compared the short-term that effectiveness and long-term sustainability of health camp in Karnali region. And according to him, health camps are transient in nature, and there is health camp is not the permanent solution.
No.
So the permanent solution to improve the holistic health of Karnali province is Karnali Academy of Health Sciences, which is acting as a beacon of hope for most of the Karnali people and the people in our country. And we have a mission to train healthcare leaders through top-tier education, innovative research, patient-centered care, public health advocacy, and community engagement, with the vision to lead health education and services, making it as a service hub, prioritizing Nepali rural and marginalized that areas, fostering total human development. Equity, innovation, excellence, and community engagement are our values. So this is the organogram of CAS, just for your knowledge. Right Honorable Prime Minister of our country is the Chancellor of our academy, with Pro-Chancellor being the Health Minister, and the executive head of our academy is Vice Chancellor.
That'd be you.
Yeah. Yeah, we are working in three sectors, First is health education, health services, and research-related activities. Let's come to the health education academic programs. We are running 4 different schools under Karnali Academy of Health Sciences: School of Public Health, School of Pharmacy, School of Nursing, and School of Medicine. These are the academic milestones. We have started with proficiency certificate level in nursing back in 2014. And then we started health assistant course. These are certificate course only. And Bachelor of Public Health, Bachelor in Midwifery Science. And I am fortunate to be the Vice Chancellor of Karnali Academy of Health Sciences back in 2021. And after that, we could start MBBS program in our institution, which is regarded as the milestone development of academics in our academy. So now we are running MD, MS in 5 different programs: GP, pediatrics, anesthesia, orthopedics, and medicine. And from this session, we have started Masters in Public Health, Masters in Pharmacy, and BSc Nursing program. And by the end of next year, we'll add 9 more programs. And specifically, I would like to highlight here is Bachelor in Clinical Nutrition and Dietetics. See, there is a high prevalence of malnutrition in Karnali province. It's around 40 malnutrition in Karnali. So we'd like to start Bachelor in Clinical Nutrition and Dietetics, which will be the first program in our country. And we hope this program will significantly contribute to reduce the that prevalence of malnutrition in Karnali. And we are also proposing the Rural Health Fellowship, and we are committed to start this program by the end of next year. So these days, these sort of headlines, news headlines, we got to know from various medias, It was very difficult to get even a single doctor just 7-8 years back in Karnali. Now they are writing like this: Karnali, once synonymous with poverty, hopes to become a center of Nepal's medical education. And this is the news published, I think, 7-8 days back, and says Indian student in Jumla to study medicine. That is a huge transformation, I guess. People, students from India are joining us there in Karnali Academy of Health Sciences to become a doctor. So within short span of time, we are being able to start various programs, maintaining the quality of those programs in our setup. And many people were skeptical, were questioning me about how you can guarantee the quality education in your setup. It's very difficult to get a specialist doctor there in Jumla, but it will be difficult for you to maintain the quality of education. But first batch of our Bachelor in Public Health graduate got 100% license pass result, while the national average was 54%. Similar result we got in nursing. This is a very good example of that we are providing the quality education in Karnali Academy of Health Sciences. So Regarding the health services, we have 300-bed hospital in Jumla and providing almost every sort of specialist care by our 300-bed hospital. And there is another program running by our hospital, which is District Health Strengthening Program, which is the beauty of Karnali Academy of Health Sciences. See, our catchment is 13 different districts, underdeveloped district of Karnali province and our Western province. So it is very difficult for our government to send a specialist to district hospital in current scenario also. It's very challenging. But Karnali Academy of Health Sciences is sending its specialists to various districts throughout the Karnali and helping to strengthen the district health system. This is, say, there are 13 districts under Karnali Academy of Health Sciences, and we are trying our best to help the health system out there in district hospitals. This is the significant work done by Karnali Academy of Health Sciences. So the last part of clinical service, this is the patient flow in the central hospital in Jumla. I'm not talking about the outreach center. And within 5 years, there is 3.5 times increase in patient flow in our hospital. That is another significant achievement that we got. That is because we are trying to excel in our health service via Karnali Academy of Health Sciences. And there is a beautiful thing that COVID story related with Karnali Academy of Health Sciences. You could see the first picture where there are plastic instead of PPE. This picture taken during initial days of COVID, where even the PPE was not available in our setup. And our internist and lab in charge, they're in community to take the swab of people coming from India. That is how we send our people in community and try test and treat the COVID cases. And the second case is in helicopter. You could see that swab collected in helicopter. This is because Dolpa and Humla are the two districts not connected to national road network. So people from that migrant worker from India returned to their village in Dolpa and Humla, and it was very difficult to reach out to them. So we, Karnali Academy of Health Sciences, requested province government to manage a helicopter to go there and treat them. There were two benefits. See, I was the hospital director during COVID period, and we coined the term Karnali March. You could see here, Karnali March. That does mean we sent 43 of our doctors, nurses, and paramedics to 19 various strategic places throughout the Karnali. And they did two things. Number one is they tried testing, isolating, and treating COVID patients. And number two is it was almost all the hospitals were closed during COVID period. Even the non-COVID cases, it was very difficult to get treatment. So our 43 doctors and nurses try to treat non-COVID patient in the community as well. So this idea was owned by the province government that time. It was hugely appreciated, and we started establishing the PCR lab in our setup, which was quite challenging that time. And our lab, our PCR lab was second only to the national laboratory in Kathmandu run by the federal government. We tested highest number of COVID in our lab. We are the second highest who test that antigen during COVID era. That was the significant achievement we did during COVID. And we have one journal, Karnali Academy of Health Sciences, and we publish that COVID special issues throughout the COVID period, and many of the faculties and activists related to COVID got to publish their work by that journal. And this shows the mortality rate of COVID. It was lowest in Karnali province, and there was, I think, some contribution from Karnali Academy of Health Sciences as well. Yeah, let's go to the research. Karnali Academy of Health Sciences has potential to have excellent research projects in various research areas like epidemic research, medicinal plant research, mountain medicine research, health economics research, and research related to maternal and child health, and research related to malnutrition. Let's talk about the epidemics. It was very common in Karnali region. Karnali region was very prone to epidemics. According to Dowler, who is from America, who is the president of Global Health Council at that time, back in 1991, published a report. And according to him, diarrhea, ARI, and malnutrition were the leading cause of epidemics and death in Karnali province. And there was only one doctor available for whole of the province back in 1990, and it was written by Bishop. Say, back in 2009, there were 121 deaths in Karnali province, 2 or 3 districts of Karnali province, after cholera epidemics. Back in 2015, there were 64 deaths because of influenza in Jalipur district of Karnali province. So this shows that gravity of epidemics in Karnali province. There were several metaphors created based on that epidemic. Say, that does mean, may the epidemics take you away. If I am angry with you in Karnali, I will tell like this. That shows this culture, the cultural faith illustrates the profound impact of the frequent epidemics in Karnali. See? Yeah, this is one of the most important part where we can excel medicinal plant research in Karnali via Karnali Academy of Health Sciences. This is because Karnali region is the hub for valuable medicinal plant and herbs. According to the data from government, over 400 different medicinal herbs and plants are available in Karnali. And it found across all 10 districts in Karnali. So these are some important plants and herbs. These are the news headings. Herbs emerging as the main source of income in Karnali. In Karnali Highland, harvesting medicinal herbs is the way of life and special livelihood. So we from Karnali Academy of Health Sciences, our team has submitted a detailed proposal on establishment of that medicinal plant research and processing center at Karnali Academy of Health Sciences to University Grant Commission last month. We are hoping to get some grants from University Grant Commission and we start from scratch because there is a huge possibility of development of that research center related to medicinal plants and herb in Karnali. This is one potential area. So obviously, there is disparity, difficult accessing the healthcare and poverty. There is a potential to have some research on health economics as well. As I have already said that there is high maternal mortality rates, there is high prevalence of malnutrition. Karnali region faces severe child and maternal death challenges with that high malnutrition rates. So CAS can serve as a base for maternal, child health, and malnutrition research due to the region's unique challenges. And we can take this as an opportunity to use Karnali region as a case study for implementing effective measures. And overcoming the challenges in Karnali can provide insights applicable to not only to Karnali, but also to similar regions globally. And we are publishing our scientific journal in every 4 months. So after knowing the difficulties getting that healthcare facilities in Karnali and starting an academics in that part of the world, but what I think is those issues, those agendas, those problems can be addressed by establishing a Department of Global Health and Social Medicine in Karnali Academy of Health Sciences. So the final agenda of my talk is on establishment of that Global Health and Rural Medicine Department in Karnali Academy of Health Sciences, and I'm really hoping to have some sort of collaboration with Global Health Department at Harvard Medical School as well. So even after federalization, even after promulgation of new constitution, many of that local level still are lacking. They have not that proper health policies in our country. So critical analysis of health system and policy innovation would be the one area where our department could address, right? So it will support formulation of scientific health policy and implementation, and it can determine the health system resilience and vulnerabilities. Second part of our that function of our department would be advancing research and evidence-based practice. So it will help to create intervention tailored to rural health needs, because there have been very few research and studies conducted within this population. And we'll try to examine social determinants of health, because health is the only one part, and there are several non-medical factors that impacts the health outcome. So, and it will address the health inequalities as well. So these are the programs we are aiming to start via our that department, and it's under capacity building, global health research, innovation, and leadership. So MSc Global Health, we are thinking of running this program for the duration of that program will be 2 years, because global health is new concept to our country. We are running masters in public health in our setup, but we are aiming to start the masters in global health as well. And to contribute in quality and safety and clinical management, we are hoping to start that MSc in health service delivery as well from our academy. And you see, under Karnali Academy of Health Sciences, we are affiliated with 13 different district hospitals and 79 local level hospitals. So until now, it's very difficult to get that clinical doctor in local hospital. So we are aiming to start the fellowship on global health and social medicine. That will be a 1-year course, so that our fellows would be rotated in every local level hospitals. And residency and rural medicine, that is very interesting. We are running the MDGP program, MD in general practice, but the social aspect of our service is lacking in that course. We'll try accommodate leadership skills and social aspect of that clinical care in that program. That would be another interesting course. And the final, I think most of you have heard FCSB, Female Child Health Volunteer, the foundation of Nepali health system, low-level healthcare worker, and we want to have some certificate level training to them to upgrade their skills and knowledge. And this is my final slide. Me and Dr. Pradesh are talking about organizing that Global Health Congress in Karnali Academy of Health Sciences by late 2024. And we are in close connection with some people from Ministry of Health and some people from African Union as well. So I'd like to invite and I'd like to request to have your advice and input regarding this issue as well. So there are other fields where we can have some contribution by establishing the Department of Global Health and Social Medicine. Like we can do something on global health emergencies, and we can do advocacy and community engagement as a part of a team. So with this, I'd like to conclude my presentation and
What a wonderful and inspiring presentation. And I know I have some chance to talk to you tomorrow. So let's see if there are any questions or comments. Yes, go ahead.
Hey, that was a great talk. And you did a very, very nice job of setting the groundwork for us, telling us what you're dealing with and what you've done. You've done a remarkable job setting up a complex 300-bed hospital up there in the middle of nowhere. I thought Nepal-Gunj was the middle of nowhere, and you're 12 hours away from that because I looked you up on the map. What are the incentives to get these specialized physicians to move up there, set up their lives up there, and be your faculty? I'm thinking you've got an orthopedic program up there, you've got all those pediatricians and so forth. I'm thinking if I'm a young guy finishing Shankar's program in Kittur, I need a job somewhere. Why should I come up there? And then once I get there, why should I stay? How do you do that? How do you do that? Because that's a question globally. In every low-income country in the world.
It's true in the U.S. too.
It's true in the U.S. Exactly.
This is really a great question and a very difficult question to answer. I think so.
That's why we ask it.
Yeah, it's very difficult to retain that quality health manpower, especially the specialists, even in Kathmandu. So obviously, it's very difficult to retain that specialists in my setup. But there are some incentives we have developed in our setup, like the people working in our academy. Usually, what we do is we bond them. We bond for some years, and we sponsor them for their higher education, so that they come and join us and work in our institution for 2 years or so. That is one incentive, but beside that, it's very challenging and it's very difficult to convince that specialist, and it's very difficult to retain specialists in our setup. But I'd like to know from you, what can I do to retain specialists in my setup? Really, it's a real challenge that we are facing these days in Karnali. Yeah, this is, I think, the #1 challenge that we are having there. Sure.
Go ahead.
Yeah, thank you for this wonderful presentation. And one thing I would like to mention about this future plan, which is to establish the global health division of the department. If I can be part of that, I'll be more than happy. That is one thing I'll be happy to contribute. And second thing, we did not mention about mental health in Karnali province. Again, as a psychiatrist and working in global mental health field, I was interested to know a little bit about the status of psychiatry or mental health in academic.
Thank you so much, Dr. Sridhar. Rightly mentioned. I forgot to mention the status of mental health in Karnali. It's quite challenging these days. So I expect your presence there in Karnali to have some contribution to uplift the mental health of Karnali province. Because it's very difficult to get a psychiatrist in our country because of less production of psychiatrists. So I'd like to request the people like you. Right? You're working in that Mass General Hospital, one of the biggest hospital, having biggest department in psychiatry. So let's have some collaborative work so that we can uplift the mental health of our Karnali people via Karnali Academy of Sciences. Thank you so much.
Thank you.
I have one question. So the interesting over there is the chancellor, co-chancellor, and the vice chancellor. So you seems to be working with number of ministers and prime ministers. How do you get them, convince them to get your job done? And what is the challenge that you face to get the resources from the ministry?
It's another difficult question. Yeah, you see, I want to share my experience. Since last 3 years, I'm the vice chancellor since last 3 years only. And in the last 3 years, there were 9 minister change in my country, 9 ministers. I got to health minister and 3 prime ministers. Wow. Political instability has hugely impacted each and every institutions each and every organization in our country. That is the major challenge that we are facing these days. But regarding Karnali, we are honest. We are trying our best to uplift that overall status of Karnali via Karnali Academy of Health Sciences, and we are getting good support from all the ministers, whatever the background they have, they are supporting us in our mission. It's quite challenging. Thank you.
We have a Zoom question. If you'd like to jump on in.
I think you're referring to me. Is that right? Can you hear me? Okay. Namaste, Dr. Rao. It's very, very nice to meet you. I'm sorry I couldn't be there in person, but I am very, very inspired by your talk and everything that you've done in the last several years in Karnali. My name is Ruma Rajbandari. I am a physician here at Mass General as well, and I've done work with the Nick Simons Institute in Nepal to essentially help district hospitals in the country. I was just wondering about your linkages to the other district hospitals and what kinds of supports you provide to the other hospitals in the country, and what that relationship looks like, because given the very difficult geographic conditions, it seems like developing these district hospitals is also an important priority for the region.
Thank you so much, Dr. Ruma. Yes, I'm happy that you are affiliated with the Nick Simons Institute, which is doing very nice job in healthcare sector of Nepal since last many years. We are linking to district hospital via the local government. What we do is we do memorandum of understanding between the local government and Karnali Academy of Health Sciences regarding all the incentives, regarding all the accommodations and service. Via that mechanism, we send our specialists to various district hospitals, and they serve via that district hospital. That is the mechanism, because it is much easier for us to collaborate with the local government, as we are also the government entity. We are not the private entity, so it's much easier for us to have a collaboration with various tiers of the government. And we are sending many specialists to almost every district of Karnali in some periods. For example, in the Humla district, it was very difficult for our government to send even a specialist for years. So now there is a gynecologist from Karnali Academy of Health Sciences. Likewise, in Mugu district, our GP went there and served there for 3.5 years. In other, that Kaliko district, we are having MOU with 4 local governments, and we are sending 4 doctors in. Our 4 doctors are there in the Kaliko, providing the clinical services by local government. Likewise, we are expanding our service in collaboration with governments and hospitals. Thank you.
That's wonderful. Thank you.
The last question.
Thank you very much for your fantastic talk. I really enjoyed it. It was evident from the images that you shared with us that orthopedics is really a critical problem in terms of volume and also the complications that you see. And it was also evident that the bone setters seem to be the first point of care for many patients, and yet ends up having far greater complications than you would have had the fracture just been left alone. So my question to you is there any formal education that's being offered or partnership that's being offered with these bone setters? Because culturally, people may still go to them and still may end up with these complications. So are they involved in the fellowship of the rural health I saw that was being mentioned for 2024? How are you harnessing their expertise, but also trying to mitigate the complications that may occur from their care?
That's a great question and suggestion for me as well. There is no any systematic way of collaborating those bone setters, training them via Karnali Academy of Sciences, but via the mechanism of health camps and other awareness program. We go to community and talk to the people out there and not to go to bone center. And we counsel the community regarding the possible complication associated with that tight splint test. So by those activities, they got to know day by day, and the incidents of those such bad the incident are decreasing day by day in our province. But we don't have that sort of systematic way of the collaboration or systematic that project that call all the bone center and train them. We don't have, and definitely after this talk, we'll try to do that sort of the project which can raise the awareness among all the bone setters and local community regarding such incidents.
I'll connect you with Kieran Agarwal Harding because he did a whole series on bone setters and the education of bone setters.
Wow.
I'll do that.
Sure.
So we are past the time. So I'm very glad. So you all of guys attended. So, and thank you so much for the Department of Global Health and Social Medicine for this wonderful opportunity to have Dr. Mangal over here. So it's an absolute pleasure for us. And with this presentation, we have a hope of establishing the Department of Global Health and Social Medicine back in Karnali Academy of Health Science. And we're very optimistic for the support from our chairman, the program director Joya, and whole of department. So yeah, I'm very excited, and like we have been looking for this day for the last 1 month, and we finally made it. Thank you so much for attending. So before you leave, I would like to request Christina, our Deputy Director of Program, to honor Dr. Mangal with a token of love.
Yeah. Thank you so much. Thank you so much. Before concluding this class, I would like to thank Dr. Pradesh so much.
Hi, I'm Dr. Santos. I just wanted to add a little bit on this because I have been to the Karnali region back in 1998 and 99. And I just was so much touched by the presentation. I work as a medical doctor, and I have a small thing to tell you. A lot of people going to the rural setting in Nepal, I think the driving force is the joy of serving the community. There's no financial joy. I must admit that, yeah. So that's what dragged me to my region, and I also have been through a lot of consequences where I've seen those things, because when I was in the rural setup, I saw a kid who used to play with me die of dysentery, and like in a couple of days, like he passed away, and we used to play. I was just 7 years old, and these sort of things I think drive us to go there and work. But having said that, again, like Dr. Mangal is working on it, we can collaboratively work on it and then make this thing a little bit, more with the incentives, and also motivate more people to go there. Because I think where there is will, there is way. He has proven that in past 3 years. I really appreciate this, Dr. Mangal, and like I'm so glad that I've been there, and I would love to be there again to see the changes. Thank you. Thank you.
Thank you so
Come
much.
back.
Thank you so much.
Thank you. Thanks so much.
No,
Yes.
that was spot on. Exactly.
I'm just.
My brain was thinking, I couldn't, my brain wasn't getting the words to say it.